Snapping hip syndrome. Snapping hip syndrome, also known as coxa saltans, is a condition that is characterized by a snapping sensation, and/or audible, snap, or click, noise, in or around the hip when it is in motion. Types. External snapping hip syndrome, most common type. Internal snapping hip syndrome. Intra-articular, least common. Epidemiology. Common in athletes and dancers in their teens or 20s. Etiology. 3 types of snapping hip exist with different causes. 1. External snapping hip. Most common form. Caused by iliotibial tract sliding over greater trochanter. 2. Internal snapping hip. Caused by iliopsoas tendon sliding over femoral. 3. Intra-articular snapping hip. Caused by loose bodies in the hip, may be seen with synovial chondromatosis. Labral tear. Symptoms. Snapping sensation in and around hip joint. May be painful or painless. Patient often able to reproduce snapping. Aggravated by activity. Clicking or locking sensation more indicative of intra-articular pathology. Physical examination. External snapping hip is often visible while internal snapping is not, but may be audible. External snapping one can see from across the room, while internal one may hear from across the room. External snapping hip. Palpate greater trochanter as hip is actively flexed. Applying pressure will likely stop snapping, confirming diagnosis. Tightness of tensor fasciolata diagnosed with Ober's test. Limited hip adduction when hip held in extension. Internal snapping hip. Snapping is reproduced by passively moving hip from a flexed and externally rotated position to an extended and internally rotated position. Imaging. 1. Radiographs. Recommended views. AP pelvis, hip. Findings. Usually normal. May be useful to rule out synovial chondromatosis. 2. Ultrasound. Dynamic study which may demonstrate the snapping band in either internal or external snapping. May be used to localize a diagnostic challenge injection into the trochanteric bursa, external, the iliopsoas sheath, internal, or intra-articular space. 3. MRI. Useful to rule out intra-articular pathology, often performed as an arthrogram study. May show inflamed bursa. 4. Iliopsoas bursography. Iliopsoas tendon visualized under fluoroscopy after bursa injected with contrast dye. May add therapeutic injection after diagnosis is confirmed. Differential diagnosis. Intra-articular hip disorders. Trochanteric bursitis. Iliopsoas bursitis. Iliotibial band syndrome. Iliopsoas syndrome. A hip pathology characterized by internal snapping hip, iliopsoas tendinitis, and iliopsoas bursitis. Treatment. 1. Non-operative. Often internal and external snapping are painless and require no treatment. Activity modification if acute onset, less than 6 months, of painful internal or external snapping hip. Physical therapy. Injection of corticosteroid if persistent. Painful snapping interfering with activities of daily living. Operative. 1. Excision of greater trochanteric bursa with Z-plasty of iliotibial band. 2. Release of iliopsoas tendon. 3. Hip arthroscopy with removal of loose bodies or labral debridement repair. Thank you.